It is so counterintuitive. Eat meat, eggs, cheese, lose weight. NBC Chief Science Correspondent Robert Bazell tonight with a new study.
Here's the most important thing to remember. The studies on these foods
takes on one of the biggest diet debates. Is it more important to cut carbs or fat if you want to lose weight and stay healthy? Here with what the researchers found.
Is one healthier than the other? Is one healthier than the other?
I think low carb,
is healthy?
metabolically and nutritionally, is healthy.
There are certainly doctors out there who like to say things that aren't true because the media loves stories like that. They love to have a doctor say, oh, meat is good for you.
Hey everybody, this is Klaus from Plantbased News. So in this video I interviewed Dr. Dean Ornish, the pioneering heart health doctor. I interviewed him at PCRM's Nutrition and Medicine Conference. And I want to say if you're interested in any of the topics discussed in this video, then you would definitely be interested in a free summit, which I've linked down below. It's put on by Ocean Robbins. It's 100% online, so you can access it from anywhere in the world. There'll be some more information by Ocean Robbins at the end of the interview. But in the meantime, I hope you enjoy the interview with Dr. Dean Ornish. Dr. Dean Ornish, thank you so much for doing this.
My great pleasure.
You recently featured in The Game Changers, which has been getting a huge amount of attention. How was that experience?
Oh, it was great. You know, I think that this film is really going to be a game changer, hence its name. You know, it addresses the most common misconceptions people have about eating a plant-based diet, which is that, you know, you're a wimp and you don't get enough protein. And so having all these elite athletes who raised their game and became Olympic medalists and heavyweight boxing champions, mixed martial artists, national champions, NFL superstars, and so on, is really going to help people understand that when you go on a plant-based diet, it makes you stronger and more powerful and more effective.
I think there's going to be a lot of backlash and haters and naysayers when the film comes out. In fact, online in the keto community, the ketogenic diet community, there's a lot of people saying, for example, that Arnold Schwarzenegger could never have built his muscle off tofu and lentils.
Well, the best narrative is to listen to Arnold Schwarzenegger himself, you know, who says, you know, he knows this world, he grew up in that world, and when he says that this is the best way to be strong, why wouldn't you believe him of all people?
Some people on social media are saying that the film has a plant-based agenda. What do you say to these people? You probably had these people in your career saying your work is just some holistic agenda.
Well, if an agenda means you're trying to present evidence that's scientifically based so that people can make informed choices, yeah, that's what it is. It's an agenda to try to educate people about the power of these simple lifestyle choices that we make every day. That's exactly what it is.
Some other critiques of the film say that it's fear-mongering around fat. You obviously promote a low-fat diet. What do you say to these sort of naysayers and haters and shock jocks that are making these accusations?
Well, there are lots of people who recommend things that aren't good for you, you know, that they may sound good. You know, the reason I've spent 40 years conducting the highest quality research published in the leading peer-reviewed journals is that's really the whole point of science, is to help people sort out what's true and what isn't. And we've been able to show in studies over the last 40 years that these simple lifestyle changes, a whole foods plant-based diet that's low in fat and sugar, moderate exercise, various stress management techniques, including meditation, and psychosocial support or love and intimacy, or to reduce it to its essence, to eat well, move more, stress less, and love more, can actually reverse the progression of the most common chronic diseases. And it's not all or nothing. To the degree that you move in this direction, there's a corresponding benefit. Even if you're not ready to go on an entirely plant-based diet, have a meatless Monday. You know, whatever you do, in all of our studies, we found the more you change, the more you improve at any age.
You've obviously done so much over the last 30, 40 years, yet it's not integrated significantly, I think it's fair to say, into the kind of mainstream system, certainly not as much as we'd like. How much of the kind of keto camp do you think has held back your work in the sort of plant-based lifestyle medicine kind of movement?
After doing this work for 40 years, this is finally the right idea at the right time. On the one hand, Medicare and most insurance companies are now covering my program for reversing heart disease. We've been training hospitals and clinics around the country. We're getting bigger changes in lifestyle, better clinical outcomes, bigger cost savings, and better adherence than anyone's ever shown. Now the keto or paleo or just the latest versions of the Atkins diet, which itself was a later version of earlier kinds of things like this, it's worth mentioning that when Dr. Atkins died, his autopsy was released, which showed he died of massive heart failure. Studies have shown that when you go on a keto or paleo diet, your risk of dying prematurely from heart disease, diabetes, prostate, breast, colon cancer goes up significantly. There are certainly doctors out there who like to say things that aren't true because the media loves stories like that. They love to have a doctor say, oh, meat is good for you. And then you say, well, how much nutrition training do doctors get? And I co-authored an article in one of the leading peer-reviewed journals here a few months ago with my colleagues from the American College of Cardiology's Nutrition Committee, and we found the average doctor in the U.S. gets 4 hours of nutrition training a year, and the average cardiologist in 4 years of training gets 0 training. So doctors may say all kinds of things because they don't know any better. The media love that because they're always looking for clicks and they're looking for readers.
Playing devil's advocate here, but I guess your argument is that doctors don't recommend plant-based nutrition because they're not trained in the nutrition field. But then people argue that, well, dietitians or people studying dietetics also don't recommend plant-based nutrition.
Well, the American Dietetic Association recommends a plant-based diet, so I think things are changing. And it's good that they are because, we actually have over a dozen men and women who had such severe heart disease they were waiting for a heart transplant. Their heart was in such bad shape, they said the only thing that's going to save their life is to get a new heart. And while waiting for a donor, they went through my program, and 9 weeks later, their heart is so much better, they didn't need a heart transplant anymore. It's like, what's the more radical intervention here, a heart transplant or eat well, move more, stress less, love more? There's more evidence than ever if people want to see that.
You've obviously just said that keto people are pretty good at getting airtime, and that's probably because they're telling people what they want to hear. You, however, have been able to navigate the system, and you've influenced a lot of people and got a lot of sort of mainstream attention. How have you been able to do this?
Well, the truth is very powerful, and the whole point of science is to find out what's true, and my role is to first do the highest quality research to see what's true, and then to get it out there, like interviews like this, to having seen what a powerful difference these changes can make, I want to make it available to people so they can make informed and intelligent choices. And what happens on a keto or a paleo or an Atkins diet was shown very graphically in an article that was in the New England Journal of Medicine by Stephen Smith a few years ago, and said what actually happens in arteries on different diets. And at the top they showed an artery of someone on a whole foods plant-based diet. It's clean, it's unclogged, the blood is flowing through very normally. On a standard American diet or a typical British diet, they're partially clogged. And on a ketogenic or paleo or Atkins diet, they're severely clogged. Even if they lose weight, even if their blood chemistries may look a little better, if you look at really what matters, which is really what's happening in your arteries, you get much worse on those kinds of keto and paleo and Atkins diets. So, I'm not here to get anybody to do anything. I just want to make sure that people, when they make choices, do it on the basis of scientifically based, accurate information.
You've affected a lot of people in your career. You've had a lot of influence. Can you just talk about what happened last night at the Physicians Committee's gala, where Bill Clinton came up on the screen to thank you?
That was a nice surprise. Bill Clinton made a testimonial talking about, 10 years ago, his bypasses clogged up, and his cardiologist held a press conference and said, it was all in his genes, and his diet and lifestyle had nothing to do with that. And having been working with him since 1993, when I was asked to train the chefs that cook for him at the White House and Camp David and Air Force One and so on, and to be one of his consulting physicians, I knew that his diet and lifestyle had everything to do with it. So I sent him a note, we met. He then went on this lifestyle program that I developed, and he's been doing it now for 10 years, and he's continuing to get better. And so I think whatever your politics, when a former president, especially one that wasn't known for particularly eating very healthfully, makes these changes, I think that sets a beautiful example for everyone.
You mentioned off camera that you've recently been to London, which is where I'm from. What were you doing there?
Yeah, my wife and I met with His Royal Highness Prince Charles again. He's very interested in our work and the possibility of the National Health Service making the program available. And also this whole new movement of what's called social medicine, social prescribing. It turns out that the real epidemic in both the UK and the United States and in so much of the world is what I call emotional heart disease, loneliness and depression and isolation, with the breakdown of the social networks that used to give people a sense of love and connection and community. And study after study have shown that people who are lonely and depressed are 3 to 10 times more likely to get sick and die prematurely from pretty much all causes when compared to those who have that sense of connection and community. And I don't know anything in medicine that has that big an impact. So in the last 3 years in the UK, they've come up with something called social prescribing, where the NHS will cover a doctor referring, because the average visit from a doctor is like 10 minutes. You really don't have much time to talk about diet or exercise or what's going on in your family or your job or your school or your work or your kids. And so you can prescribe, if you're a doctor, other ancillary personnel to spend time with patients to help them with their diet, with their lifestyle, with what's going on in their families and so on. And realizing that that's not only the right thing to do, but it's also cost effective as well.
Do you think there's like less or more stigma when it comes to talking about creating awareness around mental health and love and connection compared to, for example, getting people to ditch animal products? Both are obviously stigmatized. Yeah, from your experience, what's been harder to promote?
Well, it's hard to understand why someone would have a resistance to teaching people how to love more and to be more compassionate and altruistic and forgiving. These are spiritual truths that are found in all cultures and all religions and all pathways because they work. The one emotion that's been most constantly and consistently linked with heart disease and so many other chronic diseases is chronic anger. You know, if I'm angry with somebody, it hurts me as much as it hurts you. If I point my finger at you, there's 3 fingers pointing back at me. And so the most selfish thing we can do is to learn to be more compassionate and loving and altruistic and forgiving. You know, when you forgive somebody, it doesn't condone or excuse what they've done, but it frees you from the suffering that goes along with that.
Last question, are things happening, are things changing fast enough?
Well, I've been doing this work for 40 years, but I think we're hitting a point now where it's happening, these changes are happening exponentially. Because on the one hand, the limitations of conventional approaches are becoming clear. At the same time, the power of these lifestyle changes is also becoming more well documented. Things are changing in the United States. It took 16 years, but Medicare created a new benefit category to cover my program for reversing heart disease. And most of the major US insurance companies are doing the same thing. And they're finding that it's actually cutting their costs in half in the first year, by 50%. Now, the National Health Service is reaching a crisis point, and that's happening in the US as well. Simply, you know, paying more drugs, more surgery isn't really reducing costs, it's only increasing them. In my new book, which is called Undo It, I review all of these studies and say, why is it that these same lifestyle changes can reverse and prevent so many different chronic diseases? And the theory that I put forth there, which I think is true, is that I was trained, like all doctors, to view heart disease and diabetes and prostate cancer and high blood pressure and high cholesterol as different diseases, different diagnoses, different treatments. But to me, I'm realizing that they're really the same disease manifesting and masquerading in different forms because they all share the same underlying biological mechanisms, which in turn are directly influenced by these lifestyle choices we make each day. And that's why it's not like there's one set of diet and lifestyle recommendations for treating or for preventing or reversing heart disease, a different one for diabetes, and so on. It's the same one that we found that can help prevent and reverse all these conditions. That's why you often see that the same person will have multiple what are called comorbidities. They'll have heart disease and high blood pressure, high cholesterol, diabetes, be overweight, and so on, because they're really the same condition coming out in different ways.
Heart disease has become a global epidemic. It's the #1 cause of death on this planet. Have you or a friend or family member had a heart attack? Chances are you know somebody who has. A heart attack occurs every 40 seconds in the US alone. But the good news is there is a growing and overwhelming body of evidence now. Your choices can be absolutely critical to preventing and even to reversing heart disease. So what's the #1 factor you need to focus on if you want to help heal and prevent cardiovascular disease? It is the food on your plate. My name is Ocean Robbins. Each year, my dad and colleague, John Robbins, and I host the Food Revolution Summit. You may have heard of his work. He's the 2 million copy best-selling author of A Diet for a New America and a lot of other books as well. In the Food Revolution Summit, he interviews 24 of the top food experts on the planet. During this free online global event, you'll get access to some of the most brilliant, revolutionary experts and ideas about food and health. You will leave the Food Revolution Summit with trustworthy, actionable, empowering information that you can use right away. So enter your name and email right on this page to join in the free summit and to get your Heart Healthy Superfoods Handbook. The truth is, you were meant to thrive. So grab the tools you need to put this life-changing wisdom into action. Enter your name and email, and I will see you in the summit.